what is the real risk to go back to business as usual and to waste another root crisis? Because mostly we had, well, this century, we had several crises, financial and fiscal sector crisis, other crises. What is the risk really to not work on this issue about health and smart cities, smart buildings, and business as usual?
I would just say, I don't think there is really a choice at the present moment. It's not about going in reverse. The crisis, but the crises are far too pressing to allow us to not go forward. And besides, as a Greek philosopher once said, you never step in the same river twice. Ultimately, you know, we learn, we're human beings, we're going forward. Let's not go back.
You are optimistic. Nimish, are you so optimistic?
Well, for me, I think prevention is better than cure, right? I think we have already learned a lot from our past mistakes. And actually, the fundamental problem has always been to think in a very siloed manner. This has been like the bane, and I think it's almost in every discipline, actually, you see this particular thing happening. But for me, I mean, I think apart from, let's say, the digital bit, I think it's the physical environment which really needs to be rethought. It's really critical because these things will directly or indirectly come and impact you, no matter what you do, no matter what you say. So like climate emergencies are already creating havoc. So it is impossible to actually say, like, even if we let's say make a very robust digital infrastructure, the underlying essence of, let's say, what we are doing to our natural ecosystems, how we're destroying this, is actually going to directly impact us. And it's only going to be creating more data and more data in terms of, okay, what are the comorbidities that are actually occurring? So I think it's really high time that we start thinking in conjunction, start thinking in terms of relationalities, and therefore think about shaping our built environment and health together.
Raju?
Yeah, I think it's going to be a new normal, because I don't think it's, you know, you're going back to pre-COVID. People talk about going back to pre-COVID, but I don't think that world exists anymore. So it's going to be a new normal because we have learned better ways of doing things out of necessity. So it will be a pity to go back to pre-COVID. So I think we should learn from that and then move on. So it's not going to be, so again, back to my healthcare delivery example. So it's not going to be brick and mortar kind of healthcare alone. And it won't be just clicks alone. So it's not bricks or clicks. It's going to be an integrated and hybrid fashion of how healthcare is going to be delivered, how it's going to be received and received. Thank you.
I think that the major lesson we have to learn, to answer to your point, if we don't want to go back in the old shoes, as I say, is to learn that the city is a system. You cannot do what you were doing before. You make a transportation plan, you make a better plan, you make, and things don't work. Look, I'll give you an example, a very simple example. The problem of reopening schools is not only European, it's all over the world. So where were the first attempts to reopen schools? To improve the inside of the school. You change the seats, you move them, you enlarge them, you put wheels so the students can be a little more apart from each other. It was a total failure. How many schools opened and closed again? All over the world. Now, at least in my small country, they have learned a little lesson. So then now they start to think in terms of transportation of the students, inside of the student of the schools. There are other parameters, and they take care very much of the health of the teachers. They look into the families. So is a sort of more systemic approach that quite probably will bring some results. On the other hand, the total city has to be conceived like a new system. We know very well we will not have healthy cities until we have ghettos. we will not have healthy cities until we don't have the right ratio of not only of green, but now we say also of water. But the solution is not the solution of making the urban trees, the urban buildings that look like trees, or to speak of the urban forest. These are, first of all, there are buildings only for rich people because they are very expensive to make and to maintain, and probably not even so healthy. But second, we then don't have to mimic the forests. We have to produce cities. I had a fantastic example to show to you, which is the example of Freiburg, or Freiburg, as you want to pronounce, in Germany. If you want to see an ecological utopia that has become true, start to study that example. And you will understand. We will not have healthy cities if we don't have a systemic view of the city, which is very far from. I'm sort of skeptical for that, and on the other end, because we will not have good cities until we have good participation of the people.
That we don't have a way back. I believe there is no way back, at least in many aspects. For example, the telehealth and remote monitoring systems and home-based care model, they're absolutely set to go forward, and there is no way back there. There is no way back there. And in terms of the lessons learned, listening to all this amazing discussion, it seems to me that the main lesson should be that we should learn the lessons, and we should learn that that the data alone is not enough. The data must be collected, managed, and used in an intelligent manner in the context, in a relevant way to the context that it's going to be used, and in a very proactive and intelligent way, and to innovate. This may not sound very innovative, but for example, some time ago, the Madrid government tried to use the contaminants from the coronavirus as an early detector of to detect the spread and to track the spread of the coronavirus. Well, that might not be the best indication, for example, but at least it's under investigation. It may be a very good method to assess the spread patterns, for example, and then design the respective response strategies. And of course, one other lesson that we mentioned already during this discussion is to support multi-stakeholder collaboration between governments and private sector, and to also engage healthcare professionals and patients and citizens in this discussion and in this effort.